with a rotator cuff, as in most shoulder surgeries, a lot of people get caught up in trying to do this rotation, that. Trust me, if you can do this with a rotator cuff, you'll get everything else. So the focus is, for the first 3 months, on raising your arm. So in the first 6 weeks, which is passive, your goal is to take your body in this position, put a pillow so you don't hyperextend your shoulder, put a pillow to the side of you so your arm is equal to your chest, okay? And then you're going to have somebody help you to do what we call passive range of motion, which is you're going to have somebody lift up that arm and support this arm with this hand here, and just cup this hand on this side, okay? And then they're going to stretch it. And the goal is you're going to try to get more and more range of motion each day, okay? And this is really the only thing you need to focus on. The goal by 6 weeks is I ought to be able to come into the office and hold your hand up pretty much like that, okay? Where your arm is near your ear. That's my success rate story, is the arm near the ear, not the forearm. And the key thing is bending the elbow lets somebody cheat. You think you're a lot further along than you are. Remember, I only care about the range of this one relative to your head and chest, okay? So it's really about the arm near the ear, okay, guys?